It's called triage. That's a very basic thing from the military. If anybody knows anything about MASH or the show, this is how they did everything, and this is how we still do things in the hospital setting. How does that apply to people in your classes that you're teaching at that level of how are they going to be able to make those decisions based on the triage and also on their own resilience so that they don't burn out?
Yeah, there's a lot to unpack there. I think if I was to speak to the generation currently in nursing school who doesn't have a whole lot of work experience dealing with, and possibly they do have a lot of work experience, but normally students that come into the college setting to get an undergraduate degree, many of them haven't had jobs. And when you think about jobs, we're talking about entry-level jobs, jobs that you're not necessarily high on the leadership. So you're a follower, you're somebody who has to follow directions and execute. Nursing is not just that. Nursing will never be just that, because that's a very robotic thing. And although we need essential workers to do exactly what we say we're going to do, because we are a customer service based profession, we also need to make good decisions and know who to contact. So you're talking about triaging, we're talking about the hierarchy, and we're talking about medicine, and medicine has different facets. Doctors are not nurses. We don't want doctors to be nurses. We want doctors to be doctors, and we don't want nurses to be doctors. We want nurses to do the caring work, and there's a caring science behind that. But as our healthcare workforce and the job has become more chaotic and demanded more from us, and the work and the patients we take care of are more complicated and sicker, we are left alone to really manage patients, because physicians cannot always be with you 100% of the time. So we are managing them and trying to reach out to them while being the person who's caring, assessing, relaying all the information so the physician can help us do a better job of caring for the patient. That is a dynamic that's not going to be taught in a lecture hall. That's going to be a dynamic of breaking down, watching me do my job, watching me demonstrating caring. And that may make you feel extremely uncomfortable. And although that is a form of discomfort, we're indoctrinating you to do it this way, because that is what we do as a career. So nursing it's not going to be easy. It is going to be very rewarding. The days are going to be long, and you are going to get frustrated. And right now it sounds like this is not a great profession to go into, but what it does is it affords you to take better care of yourself and your family. And there's no greater reward than to take good care about the people that you want to be in your life longer. Everybody needs a nurse in their family. Everybody needs someone to care. Everybody needs to be in the know about medical knowledge, or else we would all be on IG and TikTok buying every supplement that's out there, wasting our money. We all want to be smarter. We want to think better. We want to be more efficient. And the nurse mind is highly efficient, is highly creative, knows what needs to be questioned, and knows how to ask for what they need.
But I think, see, that's the one thing I did learn in nursing, is that I thought being a nurse, you had to just follow all these rules and everything like that. And you do, to a certain extent. There are protocols in place for certain reasons about the medication, about how you do things in the process. But on the other hand, there is also a dynamic in the way that you get to do it, because you get to create that, like that persona of how you go into that room in the morning, how you leave that room at night. So you've actually you're creating a relationship from the moment you go in the room in the morning to the moment you leave at night. And if you've done connection with that patient, if you've gotten them cleaned, taken care of, gotten them fed, and what they needed for that day, you were successful. That's a successful day. And so it is not just about, one thing or the other. It is a combination of things. And I think, and because nursing can also be black and white, when you're in school looking at this, this failing and passing and grades, it's very hard to compare that to being on the floor, because those are totally different situations. So the NCLEX, taking a test, is one thing, but being able to use that information in a real setting, in a situation, is totally different. And so how do you like teach that person that you're teaching with for these basic skills and how to get through them to transition to go into that onto the floor, use that information they've already learned, and because it's not going to be easy and there's going to be failure. So how do you teach people it's okay to fail?
So you mentioned a good bit that we try to help graduating nurses understand is that's relationship-based care. You defined a successful day in relation-based care that the patient got what they needed, but what if the patient doesn't want what you're offering and you know that they need that? Then you're telling me that your day is a failure. You have to be willing to accept when patients don't want what we're offering. And it is their right.
That's
It
right.
doesn't mean that we're not successful at our job. And I think that a lot of us really lose ourselves in our sight of our job and our scope when our patients are not compliant or they're dedicated to their dysfunction because it's worked for them up until this point in time. Why should I listen to you? That's going to cost me more money. I don't like eating these certain foods. I don't feel good when I walk. I don't want to walk. I feel better when I watch TV all day. And not that any of those things are bad. Remember, everything truly should be in moderation. But I do think that we all have to decide what we want from this life, what we want from this moment. And if we're hospitalized, we're not there because we just have no place else to go. We're there because we have to redefine our goals for our wellness. A lot of diseases cannot be cured, they have to be managed. Do you want to manage it? You can manage it well, or you can manage it not well. So I think nurses really are the key to helping patients go where they want to be. And sometimes that means they don't want to take a certain med, even though it manages their disease well. There's too many side effects. We're the ones to say to the physician, this isn't going to work for them. They're going to be back in next week. This is going to actually be a bad thing if we encourage them to go against their belief system just because we want them to be better and not be in the hospital. And I think nurses are that key. And I do think physicians that are out there that listen to nurses and work with us and we work together, I do think the patient gets the best care. Now that takes time. It's time that we sometimes don't have. And everybody realizes in the US that we're very short staffed. But as you mentioned, you really have to be the one steering the ship to figure out what is okay for this patient for today. And sometimes we go backwards. People get sicker in the hospital. And we have to know that we take that home with us. They got worse. And that makes us feel like we are failures. Should we be doing this work? We don't talk about that.